First, live, local. This is Fox 12 Now.
Hello everyone, welcome back to Fox 12 Now. I'm Greg Nibbler. As always, we appreciate you joining us. And just to let you know, we start live streaming here every weekday right around 1 p.m., going throughout the afternoon, covering a wide range of topics. And you can check all of those out, those segments, at the Fox 12 Oregon YouTube channel or the Fox 12 Oregon app. Now we are talking about something that's happening on September 8th, and that is 988 Awareness Day. If you are unsure of 988 and what that is, that's part of what this segment is covering. 988 is a mental health and suicide lifeline that you can call. So it's on your phone, 988. This is a national number. You dial that and you can get in touch with somebody for help, for crisis counseling, for a number of different things. And we go into that during this interview, speaking with Monica Johnson from the 988 Coordination Office. And we just explain a little bit more about it. And again, that's the entire point of September 8th, 988 Awareness Day. And this is something that, whether you need this, whether you ever have to utilize their services, or maybe somebody you know, it's a good thing to understand what is available, obviously for free and right at the fingertips there for anybody experiencing any kind of issues. So let's go ahead and play this, and we'll all learn a little bit more from Monica. Well, first off, thank you very much for joining us here today. Really appreciate you being here and honestly helping to get the word out about this service and about what's available for people. And yeah, just to start off with that, and also, just to maybe if you could explain to everybody a little bit more, because as I've got here, you are the director of the 988 and Behavioral Health Crisis Coordinating Office. Would you mind just giving everybody a little rundown on what that is and what that means?
Sure. So thank you again for having me for this important conversation. And so I am the director of the office you just named, and we are responsible for the federal national rollout of 988. And what 988 is a 3-digit number that is easy to remember for anyone that is experiencing a behavioral health crisis. You can call 988, you can text 988, or you can chat with 988. And so what we want to do is make sure that people know that this resource is available. It is September, and in September, we celebrate National Suicide Prevention Month. And so we want to really make sure that we're lifting up this resource, because it is important for people to know that help is there when you need it. And many people still don't know. I am excited, though, that after 2 years, we're about 2 years old in July, when we turned 2, we've had over 10 million contacts that have been answered. So the need is definitely there, but we just want to really continue to get the word out about this critical resource.
Absolutely, yeah. For anybody who's going through something, any kind of a crisis, to know that you can just dial 988 and get a hold of someone. And I think to understand that a little bit more, just what a massive organization that must be to create that. So if somebody does say they're in crisis, they dial 988, they're going to be speaking to an actual person once they call that?
Yeah, so when an individual reaches out to 988, they are connected to a trained crisis counselor. That individual is there to be, first of all, judgment free. There's such a stigma still associated with behavioral health, and we want to reduce that. And so they're connected to a trained counselor, should be local to where they are, so that they can be connected to resources if that's what's needed. So that if someone needs an in-person response, instead of calling 911, you can call 988 for a behavioral health crisis, so that you can get the right type of response from a trained professional. And then, of course, if there's a need for someone to receive help beyond that, getting that help in a safe way. So that's the whole triad of what we want to build here. When people contact 988, they're, like I said, connected to a trained individual, but there are some options for some subpopulations. So, for example, if you are a veteran and experiencing a behavioral health crisis and contact 988, then there's an option to be connected to the Veterans Crisis Line. If you prefer, if you are Spanish speaking and you want to be connected to a Spanish speaking crisis counselor, then there's an option for that. If you are LGBTQI youth or young adult and want to be connected to a network to support you for that, there's an option for that. And then finally, if you are deaf or hard of hearing and ASL, American Sign Language, is your preferred mode of communication, we have video phone. So we're continuing to try to grow access to the service.
Wow, I mean that's incredible right there, just to be able to have those different options for people who may want that or need that. And I would imagine with technological improvements probably help out the ability to provide that care for everyone. I would think.
Yeah, absolutely. And we're going to continue to do that. We just want to make sure that we're able to meet people where they are and provide those services. We know the data tells us that this is important. In 2022, I just throw a couple of data points at you, not to make it too technical, but it's important to hear, I think, the magnitude. In 2022, we know that 49,000 people in the United States died by suicide. That's one death every 11 minutes. This line can save a life. And even if people think it's not them, like, I don't need this, I guarantee you that coming out of that pandemic that we had a little while ago, remember that everybody now can say, I think I know someone, if it's not me, that has felt sad, isolated, dealing with grief, loss, depressed, thoughts of suicide, concerns about substance misuse. If it's not you, look to your left or right, it is somebody around you. And we know that this number can save a life.
And I think that's so true coming out of that I believe even if someone was unaware or chose not to be aware of mental health, concerns, they certainly were aware after that and were cognizant of it. And so to that extent, also, you mentioned something about maybe somebody who thinks that, okay, well, I don't have to worry about that because I'm not having any issue. What are important things for people to know maybe about, their friends, loved ones, whoever it may be, that could be going through a crisis that they can do to help out in that situation and even associated with this number?
Yeah, so part of what we want to be able to do is raise awareness so that people can use this number. So rather I give it out. Of course
Yeah.
you think, well, of course you do, it's your job. But I actually do literally tell people that I know, you should really try this number. And so again, I think people should keep in mind that a crisis is defined by what you believe it is. It doesn't have to look like someone else's crisis. If you just feel the need to connect with someone, particularly because we are in Suicide Prevention Month and you're having thoughts of depression, feeling lonely, not sure what to do, and you just need to connect with someone, these crisis counselors are available to do that. And so this Sunday coming up, we are trying to amplify the message around 988 being a resource with 988 Day. So this is an inaugural kickoff to what we hope will be a reoccurring event every September 8th, which is a way that we can lift up what 988 is. We want to raise awareness, but we want to do that in fun, creative ways. Our tagline this year is no judgment, just help. Really emphasizing the compassionate support that is just either a text, chat, phone call away.
Wow. I mean, that sounds like it's providing so much. And as you mentioned, no judgment, just support. So very important for people to understand that too and feel comfortable calling that number. So 988, anything else that you think is important that we haven't hit on that people should really know about the number and about the service that's being provided with this?
Yeah, I really want to say in terms of the number, just remembering that you don't even have to say who you are. So sometimes people are so concerned about like I said, the stigma that is unfortunately still tied to behavioral health services. And so that you don't even have to say who you are. And so we try to make it be, what it is, what people can trust in the line. And so that's really important to us. And again, I just think, it may not be for you today, but it may be for you tomorrow. And it definitely can be for someone that you know. I encourage everyone to, you can Google 988 Day. It will come up. I have just tried it to see how you can get involved in helping to spread the word in fun, creative ways across the country. It's going to be a great day.
Well, thank you very much for helping us to do that and for joining us here today too to get that word out about 988. And you mentioned, all the different ways that it can be of assistance for people and specialized to, whatever someone feels comfortable with. I mean, there's obviously a lot of options right there to get that out. And as you mentioned, to help save lives, which is at the end of the day, what this is going to do. So, Monica, thank you very much for being here with us today. And we will definitely do our part to help get that word out.
Thank you so much. Thank you for having me.
All right, so again, there we go. 988 Day is September 8th. And thanks everybody for joining us. This is Fox 12 Now. We have more coming up here throughout the afternoon. So if you're watching live, you can join right back here at 2 p.m. for the Fox 12 Weather Podcast video edition. And you will definitely want to check that out. I understand they do have a special guest that's going to be joining. But if you're watching this after we were live, there are plenty of ways to check out all of our segments at the Fox 12 Oregon YouTube channel, KPTV.com, Fox 12 Now tab, and the Fox 12 Oregon apps. I always want to make sure everybody knows how you can find that, and we cover a wide range of topics here on this show. Feel free to send me an email as well if you would like to. Fox 12 Now, that's Fox12 Now at KPTV.com. If you have an idea for a segment, or maybe you see something on one of our other newscasts, a story that a reporter has done, and you're like, hey, I want to find out more about that, we can get the reporter on over here and actually talk about that a little bit more in depth and have the time to do so. So again, feel free to send me an email. But that's it for right now. We're going to regroup. I'll talk to you soon. I'm Greg Nibbler. This is Fox 12 Now.